question for today is, a patient came with swelling in midline of neck measuring 2 cm, 2 by 2 cm in size. Histopathological examination showed Orphan Annie nuclei. What's your most likely diagnosis? So this is a very important question which was asked in NEET 2019. So let's go. What do you mean by an Orphan Annie nuclei? So it's a cartoon character wherein you have a clear, optically clear nuclei. So when you look at these cells, you have a clear nuclei. Okay. So what do you mean by this? You can see some empty spaces here. When you are able to see through the nucleus, we call them as vesicular. Okay. So what is this? When you are seeing these things, you are able to see something like a papillae. So what do you mean by a papillae? Papillae are nothing but finger-like projections with a fibrovascular core. So all these red things are fibrovascular cores and they are lined by these cells which are big. So normally when you see a thyroid follicular epithelial cells, you can see these follicles which are lined by cuboidal epithelium. They won't be like this much crowded. So what you're seeing here is the cells are very much crowded. When you see here, they are overlapping. They are sitting one over the other. They are having an optically clear nuclei, which we call it as an Orphan Annie nuclei. And when you see here, the membrane has formed some grooves. If you carefully observe, these grooves can be seen in papillary carcinoma thyroid, and this insert is showing inside the nucleus you have some inclusion. So this is an intranuclear pseudoinclusion. So all these can be seen in papillary carcinoma of thyroid. Okay, so papillary carcinoma of thyroid is one which has got a good prognosis. It spreads through lymphatics. Okay. So this is one carcinoma which is associated with BRAF mutation. So can you recollect where have I discussed this BRAF mutation? In the very beginning when I was discussing about hairy cell leukemia. Hairy cell leukemia can have BRAF mutation. Your colonic adenocarcinoma can have BRAF mutation. Papillary carcinoma thyroid. Then your malignant melanoma, they can have your BRAF mutation. This again is an important question. Okay, so what happens in follicular carcinoma of thyroid? So follicular carcinoma of thyroid, remember, it cannot be diagnosed on FNAC. It can be diagnosed only on a biopsy because the criteria is based on capsular invasion or vascular invasion. So when you see an FNAC, it will be like cells. You're aspirating some cells and studying. You might not be able to appreciate the entire architecture. Only when you take a histopathological section, you can see the capsule. You can assess whether it's invaded or not. So follicular carcinoma can be diagnosed only on a biopsy, not on a FNAC. You can just give a diagnosis of follicular neoplasm on a FNAC. And follicular neoplasm, remember, it produces pulsatile metastasis. Okay. So it usually spreads through hematogenous route. So you can have swelling in the skull. So any person with a neck swelling and a pulsatile swelling in the bone, especially in the skull, you have to exclude a follicular thyroid carcinoma. And this medullary carcinoma thyroid itself is a separate topic because it can be associated with Men's syndrome. And you can have a very characteristic thing which we call it as amyloid. Okay, so amyloid like deposits can be seen in medullary carcinoma thyroid. And medullary carcinoma thyroid is one tumor which is going to arise from your parafollicular C cells, whereas the other tumor cells is going to be arise from your follicular cells. Okay, so anything which arises from your follicular cells, immunohistochemically they will be positive for thyroglobulin. Because medullary carcinoma is arising from parafollicular cells, they are negative for thyroglobulin, but they are positive for calcitonin. Okay, so thank you.